Good morning. I am Dr. Malik. Today we will talk about an important topic called trigeminal neuralgia. Trigeminal neuralgia. What is this trigeminal neuralgia? This is also a headache which comes usually on one side of the body, one side of the face, one side of the face. Trigeminal nerve is the fifth cranial nerve. Mainly from the brain there are about 12 pairs of cranial nerves which come out. In spite of that, there are 12 cranial nerves directly coming from the brain, and from the spinal cord also multiple nerves come. But we are talking about cranial nerves which come from the brain. So this is the fifth cranial nerve, trigeminal nerve, which supplies the face like a fan. Both the sides. It has three branches. One is ophthalmic, one is maxillary, one is mandible. So usually the ophthalmic branch is little safe. It is paired. It is usually on one side of the face. Mainly, classical trigeminal neuralgia, it usually occurs after the age of 40 years, mainly in females, mainly right side. It can affect left side also, but mainly one side, mainly right side is maximum noted in females after the age of 40. Okay, and the main feature is it is paroxysmal. It comes very without any warning. It comes and it will be like a shock, electrical shock. Pain will be like electrical shock, shooting pain, like a shock. Okay, complete face will be frozen, and when it comes, it lasts only for some seconds or maybe 1 minute. It doesn't last more than that, but it comes frequently. So usually at that time the patient will be silent and no expressions in the face. It is called frozen face. In fact, Western people call Fothergill's disease and tic doulorex. These two terms are used by Western people, but we call it one-sided pain, parsopnopy. That means one-sided pain. Migraine also is called one-sided pain, that is parsopnopy, and this is called parsopopains. That parsopo means one-sided. So one-sided pain. Usually it is because of neurovascular compression. There is one superior. The artery which is going to the small brain, cerebellum, superior cerebellar artery is very close to this nerve, that is fifth cranial nerve, trigeminal nerve. After the age of 40, that particular superior cerebellar artery becomes thick, atherosclerotic, and it compresses this laryngeal nerve, this trigeminal nerve. This trigeminal nerve is compressed. That is why what happens is the nerve, because of compression, it loses its sheath. The myelin sheath is damaged. And the nerve becomes irritable. This is the main cause. So it will be like a shooting pain in one side of the face. Only for some moments, maybe some seconds to 1 minute, and then it stops, but it recurrently comes. It comes frequently, paroxysmal. So this is to be addressed. It is important. This is type 1, that is classical type. There is another type 2, where it will be constant. The pain will be constant, and it can be on both the sides. And the pathology is same. It is neurovascular compression, but it is because of some tumors in the small brain, that is cerebellum, or it can occur because of multiple sclerosis. It's a neurological problem, or herpes. You must all be knowing herpes. What is herpes? Post-herpetic neuralgia. After herpes, some people develop severe nerve pains. That may also be one of the reasons for central things. But in that case, it can be both the sides. But 99% of the cases, this problem, this trigeminal neuralgia is only one side, and it almost causes frozen face and no reflexes in the face, because any small movement can cause pain. And one more thing is the main treatment. What is the main treatment? Drug treatment can be simply carbamazepine or oxcarbamazepine. And Gabapentin is another drug, and amitriptyline is usually given at the night, and baclofen is one of the medication which can be given. So these are the four medications: carbamazepine, oxcarbamazepine, gabapentin, amitriptyline, and baclofen. These are all the medicines which are tried. These are all the medicines which are tried. But sometimes you may not get relief from these medications. Then some earlier pain relieving doctors, they used to inject alcohol into the near the nerve. They used to inject alcohol or some anesthesia drugs like lignocaine, xylocaine, bupropion into the nearby the Gesserian. There is one ganglion, Gesserian ganglion, from where all the nerves. So they used to inject nearby that Gesserian ganglion, or near the nerve roots. They used to inject this. These are all the methods they used to try. But the thing is, some botulinum, Botox, I think you must all know, botulinum toxin you must be knowing, they used to inject that also. They were successful, but if it is not relieved by all these measures, usually medication is not getting the latest treatment. What is the latest treatment? If medication is not successful, what is the latest treatment? Number one, it is radio frequency ablation. That is some radiotherapy, radio frequency ablation of the particular part. Wherever the pathology is there, they will do radio frequency ablation. Number two, if it is not getting relieved by these methods, there is a surgery called microvascular decompression. So microvascular decompression is a surgery where they go to that particular area and they relieve the problem. The compression is relieved by surgical method, microvascular decompression. So these are the things which are done usually, and it is also not a rare condition. This is trigeminal neuralgia is a regular problem, very common problem. People come to us with this. It is mainly after the age of 40, mainly in the females, but more on the right side. But very rarely it can affect both the sides, but it is mainly only on the right side. The eye is usually spared, mainly the lower part, maxilla and mandible. This is the part which is mostly affected. So you can go for